My name is Duc Bui. I'm a plastic surgeon at Stony Brook Medical Center. And I perform a lot of breast surgery, including breast reduction as well as breast reconstruction for breast cancer. Ideal candidates for breast reduction surgery are women who have symptoms from their large breasts. Most common symptoms are shoulder pain, neck pain. Sometimes occasionally they have headaches. Other common symptoms are rashes below their breasts, especially during the summer months, as well as occasionally they have problems with function with their day-to-day activity or working, doing heavy activity and exercise and things like that. The usual time for recovery, usually by 2 weeks, you are pretty good as far as pain and comfort. By a month, you pretty much resolve and pretty much can resume normal activity, such as exercising and back to normal daily life. Not that I know of as far as having just breast reduction surgery. Over time, obviously, the normal, aging and things like that, so the normal changes, but there's no major effects. If their symptoms are interfering with their livelihood type situation, then we'll probably get a breast reduction, knowing that, however, when you undergo breast reduction, you are at risk for not being able to lactate. Although there are many reasons for women not to be able to lactate without even breast reduction. But having breast reduction surgery can affect, and the rate probably of not being able to breastfeed is around probably 50%, half and half. There's a few patients, particularly the very young patients who undergo breast reduction, their chance of having another breast reduction can occur, particularly as they age, where the breast can get larger, or sometimes even after pregnancy, where even though they may not lose as much weight as back to their pre-pregnancy state, and they may require, I've done several patients who have undergone breast reduction 10, 15 years later. So we can redo the breast reduction. However, you are more risk of having complications, particularly the nipple sensation and ability to lactate and things like that, because you're operating on operated tissue, which is more risk of wound healing problems. But it can be done safely. As long as you maintain your weight, usually, it shouldn't be a problem. Because I've done a few, women, postmenopausal women with breast reduction, and they, wish they've done it a lot earlier in their life. Usually, most insurance companies require a certain amount of tissue, the weight of the breast tissue removed, based on your height and your weight. There's usually a scale with different companies, and the most common scale is called the Schnurr scale, SCHNURR, that has, based on your height and your weight, they have calculated this number, and then they can tell you how many grams you have to remove from each breast. So usually that's the guideline that the company uses, in addition to making sure that you have symptoms of back pain, shoulder pain, grooving your shoulders from the bra straps. You have tried other conservative therapies, physical therapy, and certain medication, and still having the pain, and then they would approve your surgery. I think they sort of want to, feel comfortable with the surgeon. You can ask, how many surgeries they've done, and you can also sometimes look at some photos if you want to see post-operative photos. I do a lot of different surgeries, and breast reduction, the satisfaction rate after having that surgery is 99.5%. Practically everybody was very happy, regrets because of the relief, the symptoms, in addition to looking and feeling better about yourself.